In this video, I want to talk about the parameters for therapeutic ultrasound. Parameters are things that you will, as a therapist, select or choose or set on the ultrasound machine in order to achieve a specific outcome or a specific treatment. In this video, I'm going to talk about 6 ultrasound parameters: frequency, effective radiating area, also known as ERA, intensity, duty cycle, duration, and the site of application of ultrasound. So first, let us consider ultrasound frequency. That is the number of waves per second, or number of cycles per second, that we have in our therapeutic ultrasound. As I mentioned in the previous video on ultrasound properties, ultrasound as used by therapists in the clinic is typically 1 megahertz or 3 megahertz or somewhere thereabouts. The frequency you choose when you're doing your therapeutic ultrasound will determine 2 things. One is it will determine depth of penetration. 1 megahertz is thought to penetrate deeper than 3 megahertz. And frequency also determines the rate of heating in conjunction with some other parameters. So let's look at the depth of penetration effect of ultrasound frequency. 1 megahertz penetrates human tissue about 5 centimeters. At least that's what has been traditionally thought, just based on the known properties of ultrasound attenuation and the average density of human tissue. 3 megahertz was traditionally thought to penetrate human tissue only about 1.6 centimeters. Again, given the properties of 3 megahertz ultrasound and the average density of human tissues. However, research has shown that 3 megahertz penetrates much deeper than 1.6 centimeters. A couple of studies indicated heating at least through 2.5 centimeters deep for 3 megahertz ultrasound with no drop-off in heating from more superficial structures. And another study found effective heating with 3 megahertz ultrasound all the way to 3 centimeters deep. If the ultrasound is penetrating too deeply, you may get periosteal heating. Sometimes therapists call this bone buzz. That's uncomfortable. Usually a client will describe that as a severe acute achiness that comes on very quickly, and oftentimes they'll just pull their extremity away. For work in the upper extremity, I think 3 megahertz is fine and appropriate, given that it penetrates at least 3 centimeters deep. That's over an inch deep. Depending on what you're doing in the upper extremity, you might want to go to 1 megahertz, but at least for the distal upper extremity, 3 megahertz should be fine in terms of depth of penetration. The other effect of ultrasound frequency is on the rate of heating. So 3 megahertz ultrasound will heat tissue, human tissue, about 3 times faster than 1 megahertz ultrasound will. And there's a couple of ways to look at that. One is that since, at least theoretically, 3 megahertz ultrasound only penetrates about a third as deep as the 1 megahertz ultrasound does, that total dose or total energy is delivered to about a third of the tissue as 1 megahertz would treat, and therefore that tissue is going to heat up about 3 times faster. Another way to look at it is 3 megahertz ultrasound is going to vibrate the molecules in your tissues about 3 times faster than 1 megahertz ultrasound, and therefore it creates 3 times as much friction in any given time frame and heats the tissues 3 times faster. No matter how you look at it, it's obvious that frequency is a critical component in understanding the heating that is occurring in the tissues. One thing you will often find in textbooks or articles is recommendations for intensity or duration, and those recommendations won't include frequency, which is a critical component in determining how much energy is occurring. Another parameter that the therapist will set when applying therapeutic ultrasound in the clinic is effective radiating area, or ERA. The effective radiating area, or ERA, is essentially the cross-sectional area of the ultrasound beam. So if you saw the earlier video on properties of ultrasound, there was a image of the ultrasound beam as a little cylinder. And if you slice that cylinder, you will have the cross-sectional area of that ultrasound beam, and that's the ERA. The ERA is usually at least slightly smaller than the physical size of the sound head, because the piezoelectric crystal has to be mounted or contained in that sound head or transducer. And so the actual sound head that touches the patient is going to be a little larger than the ERA. The ERA is also usually labeled on the sound head or on the cord that is connected to the sound head. And there's a variety of sizes. Common sizes would include 10 square centimeter, 5 square centimeter, 2 square centimeter, 1 square centimeter, and I've also seen a half square centimeter ERA transducer. So in this image, you'll see some different size sound heads or transducers. This one over here on the right, that's actually a 5 square centimeter ERA transducer. This one kind of in the middle here is a 1 square centimeter ERA transducer, and this one over here on the left, where you have that tiny little end plate, that's actually a 0.5 or 1/2 square centimeter ERA transducer. The other thing to remember with ERA is that relationship between the ERA and the actual physical size of the sound head, or the plate that touches the client. So as I mentioned before, the ERA is always going to be a little smaller than the physical size of the sound head, but in some cases it's a lot smaller. So here on the right, we have a transducer that is labeled as a 5 square centimeter ERA, and I made a circle that was exactly 5 square centimeters. I mounted it on that sound head, and you can see that there's a little kind of angle around the faceplate here, but the actual physical size of the sound head is almost identical to that ERA. So you know that entire sound head, the part that's touching the client, is active or producing ultrasound. On the other hand, with the one on the left here, the transducer on the left, and this is a very common transducer that you'll see in clinics, this one is labeled with a 4 square centimeter ERA, and so I made a circle that was exactly 4 square centimeters, and I pasted it on this transducer, and you can see that probably more than half of this transducer is actually doing nothing. And it's only this small circle that is actually, producing ultrasound, presumably in the middle of this physical sound head, although we don't know that for sure. And there's a wide margin, again, probably more than twice or more than half of the physical area of that sound head, that's just doing nothing. So it's important to understand how much of your sound head is actually active, or what the relationship is between the ERA, which is labeled on your sound head or cord, and the actual physical size of the sound head. Another parameter that the therapist will set is intensity. And the intensity of the ultrasound is, in the most basic way, just expressed as power. And the power is expressed in the unit of watts. So you can think of like a light bulb, and how many watts does your light bulb have? That's just how much power it consumes. In this case, it's how much power is it putting out in the ultrasound. Now, if it's putting out, say, 5 watts, that's going to be very different if it's putting out 5 watts in that teeny tiny little half square centimeter sound head, or if it's putting out 5 watts across a much larger, say, 5 square centimeter sound head. So that leads us to this other measure of intensity that's usually used in the clinic, and that is spatial average intensity. You'll remember we talked about this in the video on ultrasound properties where we talked about the beam non-uniform ratio. Anyway, the spatial average intensity, or the average intensity, if you took a cross-section of the ultrasound beam, the formula for that is power, we just talked about, divided by the ERA, or effective radiating area. So you take the power, you divide it by the square centimeters, and you get this measurement of spatial average intensity, which is measured in watts per square centimeter. The nice thing about spatial average intensity is then it doesn't matter what sound head you're using, what size sound head you're using, as long as you have the spatial average intensity set the same, you'll have a similar effect, albeit on a smaller area with a smaller sound head. The other thing to remember about intensity that you might kind of not intuitively understand is that intensity does not influence depth of penetration, does not influence how deep the ultrasound goes. The depth of penetration is really influenced by the frequency. Another parameter that the therapist will set when they're using therapeutic ultrasound with a client is duty cycle. And duty cycle refers to how much of the time the ultrasound is actually on, or how much of the time that transducer or sound head is emitting the ultrasound. A continuous duty cycle, also known as a 100% duty cycle, simply means the ultrasound's on all the time. There's no time when the transducer is not emitting ultrasound. A pulsed duty cycle means that the ultrasound is on for a little time and it's off for some of the time. So it cycles on and off. One typical pulsed duty cycle might be 20%. That means the ultrasound is on for 20% of the time, it's off for 80% of the time. Now, when you have a pulsed duty cycle, it's important to remember that the intensity that we just talked about, the intensity that you set on the machine, is the intensity while the ultrasound is on. So if I were to set, say, a spatial average intensity of 1 watt per square centimeter on my machine, that would be, and then I had it pulsed 20%, that would be the intensity that 20% of the time that it's on, and then the 80% of the time that it's off, it would be nothing. There are some machines that let you set the pulse duration. Those are fairly rare. But typically, like for a 20% duty cycle, you might have 2 milliseconds on, 8 milliseconds off. So this pulsing is happening very quickly, but that's what it might look like. So between intensity and duty cycle, you probably got some idea that those two are going to interact or have something to do with. And so let's talk about our terms a little bit. So we already talked about spatial average intensity before. That's the average intensity across that cylinder, that beam of ultrasound. And that was like your 1 watt per square centimeter. Okay, we can add to that a new concept called temporal average intensity, and that's the average intensity over time, temporal meaning time. So if your duty cycle is continuous or 100%, the temporal average intensity is whatever the spatial average intensity was set at, okay? Because it doesn't change. But if you have a duty cycle where it goes off some of the time and on some of the time, then the temporal average intensity or average intensity over time will be lower because there's part of the time it's on and part of the times it's off, and when you average that out, it's going to be lower. That brings us to this concept of spatial average temporal average intensity, or SATA intensity. And the spatial average temporal average intensity, or SATA intensity, is obtained by multiplying your spatial average intensity by the duty cycle. So, for example, if you had a 1 watt per square centimeter spatial average intensity and a 20% duty cycle, you would multiply that 1 watt per square centimeter by 0.2 for the 20% duty cycle, and the SATA intensity then would be 0.2 watts per square centimeter. Let's look at a few more examples to really understand this relationship between intensity and duty cycle. So to calculate the spatial average temporal average intensity, or SATA intensity, you're going to multiply your spatial average intensity by the duty cycle. In this first example, we have a spatial average intensity of 0.5 watts per square centimeter with a continuous duty cycle, which means the ultrasound is on all the time. If you do the math there, you'll come up with a spatial average temporal average intensity of 0.5 watts per square centimeter. Notice that the unit for spatial average intensity and the unit for spatial average temporal average intensity is the same. So let's consider another one. In this case, we have very different parameters, a treatment with 2.5 watts per square centimeter and a 20% duty cycle. If you calculated the spatial average, temporal average intensity of this one, multiplying the 2.5 watts per square centimeter spatial average intensity times 0.2 for the 20% duty cycle, you would come up with a spatial average temporal average intensity of 0.5 watts per square centimeter. So notice in those two scenarios, we have very different settings, but we have the same spatial average temporal average intensity. Thus, we have the exact same heating effect between those two treatments, even though there's a big difference in spatial average intensity and a big difference in duty cycle between the two. The other thing we need to remember, of course, is that effect of frequency on heating, where 3 megahertz will heat 3 to 4 times faster than 1 megahertz ultrasound. Just a couple more terms here, again, mostly for you to understand the literature. There is this other concept called spatial average temporal peak intensity. So we talked about spatial average temporal average previously, but this is spatial average temporal peak intensity. And that simply refers to the spatial average intensity that you have set on the machine, and therefore the spatial average intensity while the duty cycle is on. Sometimes spatial average temporal peak intensity is a term that's used when you're talking about pulsed ultrasound settings to distinguish that setting on the machine for spatial average intensity from the spatial average temporal average intensity. Another parameter that the therapist will set when using therapeutic ultrasound is duration. And duration is simply how long you apply the ultrasound. That is set on the machine, and then it will beep usually and turn itself off when you're done. And the duration on your machine is usually set in minutes. Another parameter, if you will, that the therapist will choose or decide on is the site of application and how big an area the ultrasound is applied to. This isn't anything that you're actually setting on your machine, but you are making this decision when you are applying the ultrasound. So for this, when you document, you want to describe, where it was and also describe the treatment area that was covered. So for example, you might document dorsal wrist capsule and then 2 times the ERA. So if the ERA of the sound head that you were using, which you've also documented, was say 5 square centimeters, in this case then the treatment area would be 10 square centimeters, 2 times the ERA. Another thing that's important to document when you're doing therapeutic ultrasound is the patient positioning and also the sequence of the treatment session. So you want to describe the positioning of the extremity while the ultrasound was being applied, including any stretch that may have been applied while you were applying the ultrasound, and then any other treatments that occur either before or after the ultrasound, as sequence can have a big influence on the overall effect as well. Just to review, I want to ask you a question. What parameters influence the extent of tissue heating? The answer is really kind of all of them. You'll remember frequency, 3 or 1 megahertz, makes a big difference in how much heating occurs. Intensity, like spatial average intensity or power, will make a big difference in how much heating occurs in conjunction with the duty cycle, because the intensity and the duty cycle together is what determines your spatial average, temporal average intensity. To some extent ERA, simply because if you interpret extent of tissue heating as to how much tissue is heated, ERA will certainly influence that. And certainly coverage area. If you take that same amount of ultrasound and spread it over a larger area, it's not going to heat as much as that same amount of ultrasound applied over a smaller area. And here are the references for this part of the presentation.